Welcome to this introductory video on the new paediatric training curriculum. The old curriculum was a long list of competencies, not very user-friendly for trainees or their supervisors. RCPCH Progress is clearer, more concise and more flexible to meet your development needs and be achievable wherever you're working. This new curriculum is still structured around 3 levels of training. There are 11 curriculum domains representing the themes of skills and knowledge to be developed throughout your time in training. 1. Professional values and behaviours and knowledge. 2. Communication. 3. Procedures. 4. Patient management. 5. Health promotion and illness prevention. 6. Leadership and team working. 7. Patient safety. 8. Quality improvement. 9. Safeguarding. 10. Education and training. And 11. Research. For each domain there is a learning outcome explaining what standard is required by the end of level 1, 2 and 3. You will need to demonstrate you've met the standard described to progress to the next level of training. These 33 learning outcomes conveniently replace the endless tick boxes of the previous curriculum. Let's take a closer look using the domain for professional skills, communication, as an example. So, the learning outcome for communication at level 1 is: develops effective relationships with children, families and colleagues, demonstrating effective listening skills, cultural awareness and sensitivity. Communicates effectively in written form by means of clear, legible and accurate written and digital records. This is the standard required by the end of ST3 before you step up to the middle grade rota. There is also a learning outcome for communication skills at level 2 and at level 3. The level 3 learning outcome describes the standard you need to meet before you complete training and can move into a consultant post. As well as these generic learning outcomes for all trainees, at level 3 you will need to demonstrate that you've met additional learning outcomes specific to either general paediatrics or your subspeciality if you're a grid trainee. Your supervisor will review the evidence you've got for each learning outcome and make a judgment as to whether you have met the standard described. To help you and your supervisor understand what it means to achieve each learning outcome, we've produced a detailed syllabus for each level. The syllabus lists some key capabilities for each learning outcome. These are mandatory things you must have evidenced before that learning outcome is signed off, normally no more than 3 or 4 critical points. We've also included examples of other evidence you might want to include to help show your supervisor how you've met that standard. These are called illustrations. It's not mandatory to do any or all of these. They are just suggestions to help you quantify why something you've done is important or relates to the curriculum requirements. They may also be helpful for your supervisor to guide you towards ways of developing your skills to ensure you have fully demonstrated the required standard. Your evidence will be recorded in ePortfolio. When you create a new assessment event or reflective note, it's easy to select which learning outcome it relates to. ePortfolio will help you keep track of which learning outcomes and the mandatory key capabilities you have lots of evidence for, and where your gaps and areas for development are. For more information on RCPCH Progress, check out www.rcpch.ac.uk/progress.